Today, we are going to present a multimodal treatment technique for reading comprehension for adults who have moderate to severe chronic TBI. This treatment uses text-to-speech, or TTS, to aid in reading comprehension. This means that the stimuli presented will be both visual and audio. These clients often present with memory, comprehension, and problem-solving difficulties. Candidates must have no prior reading deficits and intact hearing and vision. Clients require sustained attention and enough independence to complete the homework.
I selected this passage for you from Harry Potter since you're reading it with your twin boys. This passage is at a 4th grade reading level. Did you read it ahead of time at home 3 times like we talked about?
Yeah, I did.
Great, how did it go?
It went okay, I think.
Okay, let's get started on your reading task today. This time, you will reread the passage and listen to it using the audiobook with your noise-canceling headphones. This passage is the Forbidden Forest scene in the Harry Potter and the Sorcerer's Stone book. The passage has 277 words. The audiobook is at a speaking rate recommended for 154 words per minute. She has 2 opportunities to listen and read the entire passage. She will then signal to me when she starts and stops the reading by raising her hand. This allows me to calculate her reading rate. Immediately after the reading, she will answer 3 factual and 3 inferential comprehension questions. They will be in a multiple choice format on the computer with 4 foils and 1 correct answer. I will read these questions aloud to emphasize the visual and audio stimuli as we target her reading comprehension. All finished? Great. Now I will ask you to answer these comprehension questions. Just select the answer you think fits best. There's only one answer. Question 1. Harry and Draco are at the A. Hogwarts Castle, B. Hagrid's Hut, C. The Forest, D. The Great Hall, or E. The Shrieking Shack.
The forest.
Question 2. Why did Harry's scar hurt? A. He hit his head on a rock. B. He had a fear headache. C. He did not eat enough for dinner. D. He dropped his glasses. Or E. The hooded figure's presence activated the pain.
He dropped his glasses.
She answered 4 out of 6 questions correctly. In order to use errorless learning, the creators of Reading and Listening with TTS suggested additional supports such as visual outlines to help her with her reading comprehension. Now we will readdress the questions she got wrong. Great job! You've been working really hard today. Let's create an outline together to help answer the questions you got wrong. Great job! This looks great. Let's try the question again. Why did Harry's scar hurt? Was it A. He hit his head on a rock, B. He had a fear headache, C. He did not eat enough for dinner, D. He dropped his glasses, or E. The hooded figure's presence activated the pain.
The hooded figure's presence activated the pain.
Great job!
So, reading the passage and the outline were all examples of visual stimuli. The clinician's voiceover and her listening to the audiobook on her headphones were all examples of audio stimuli that were used simultaneously in treatment. As you could see, accuracy for factual questions were higher in this case than accuracy of inferential questions. Reading passages and practicing comprehension questions will not always generalize a patient with TBI's ability to read functionally. However, providing them with visual strategies and audio stimuli will help to aid in their overall function of reading outside of the clinic. It is important to note, though, that this technique is not a catch-all. Work with your patient's abilities. Other strategies include making smaller sections for them to read and using pictures, captions, and headings for additional organization and visual support on their outline.